Hello, my name is Dr. Hansen with Hansen Chiropractic, and I have Karis with us today. As Karis came into our office, looks like today is about her 10th visit. She started right at the end of April, primarily with lower back pain and sciatica going down into her right leg, numbness tingling into the right foot, some upper back pain, some headaches, so a lot of different symptoms having along the spine, but the primary issue was the lower back with right pain, leg pain going down into the foot with numbness and tingling. Okay, so Karis, I'll have you go ahead and lay on your stomach face down here. And so what we discovered with Karis is that she has a problem with the normal curve in her lower back. The curve, proper measurement should be 40 degrees. Hers was just about half of that. And that's causing a lot of stress on the joints at the base of the back and into the right sacroiliac joint, which is affecting the sciatic nerve as it runs down from the low back through the piriformis muscle all the way down into the leg. So we're going to be doing adjustments to unlock the SI joint to start with. I'll have you go ahead and squeeze your knees together and then relax here. Yeah. And so you can see that right leg is short by about a half an inch. And that's called a positive Deerfield test. What's happening is when the joint is locked on her right side, it causes the right leg to be drawn up, which creates that shortness. And we'll be able to see when we're done how that compares. So Karis, I'm going to start by having you lay on your right side down and face towards me. And this is a side posture adjustment. And I'm going to start working on the lower joint in the SI on the left side. Let's go on your other side. And then we're going to be working on the upper joint on her right side, essentially untwisting the pelvis. Good. There we go. That moved great. Let's have you lay on your back then. Good. That's one of the most common causes of sciatica. This dysfunction or locking of the joints in the lower part of the back. Go ahead and sit up here. And we're going to work through the thoracic spine. There we go. Good. And be able to get some movement through the thoracic spine. And we're going to work up in the cervical spine. In her case, her neck is reversed backwards. Instead of having a curve going forward towards the throat, it's reversed backwards, which is creating a lot of compression in the suboccipital region, right at the base of the skull. And that's causing her headaches. Yeah, feel that tender right there? So she just winced there from pressure being put on the suboccipital muscles. So we're going to unlock that joint and create some extension. Nice and easy. Good. And right here. There we go. That moved good. Now we'll go back on your stomach, face down there, Karis. And this is another very important part to the adjustment. I'm going to lift up here, Karis. There you go. So when we adjust to unlock the joint, that's one part of the picture, but we also want to reposition the spine. And so in Karis's case, I'm putting her in the opposite posture, or what's called the mirror image of where she is. This helps to bring the rib cage forward, which decompresses the low back, taking stress off the sciatic nerve. There we go, that released nice. Okay, let your shoulders just relax. There you go. This helps with bringing the head back over the shoulders. Good. I'll have you go ahead and lift up here. And then back down there, Karis. And I'll have you go ahead and squeeze your knees together and then relax. And now we come out, you can see how balanced she is. Okay, so right now, her legs have completely balanced out. Okay, so what we've been able to do is to work on her right sacroiliac joint, taking it out of extension, putting more flexion into the joint. We've adjusted the left lower sacroiliac joint. We've adjusted at the TL junction, which is one of the most important areas to decompress the low back. And we also adjusted down here at the base of the neck. I did the mirror image adjusting to help to reposition her posture. And then from here, what we would do is we're going to take her over, we're going to do some traction, and then we're going to also work on some exercises to help to stabilize the low back. Putting all these things together is the most effective treatment for sciatica. Go ahead and come on up here, Karis. And Karis, you've been coming here for a couple of weeks, and if I remember right, this is your first time to a chiropractor, is that right?
Yes, that's true.
Anything you'd like to share with our audience that's been watching some of our videos?
Sure. I really love the care that I'm getting here at the chiropractor because I've gone for my sciatic nerve to other doctors and stuff like that, and they always just treat my symptoms with medicine or just like, well, if you just lost some weight, then that would totally take all the pain away, but it's just not true. I've tried all those things and nothing's worked, and like it's so refreshing to come here and like I can feel the difference every day. I feel more balanced every time I get adjusted. It's like that relief of pain, and like they have exercises that I can do that help also. So it's just like all together I feel like I'm fixing the foundation. So
thank you. Yeah, excellent. And that's what we're doing. Our whole focus is to focus on the cause of the problem versus just treating the symptom. So if you have sciatica or know anybody that's having sciatica, have them give us a call at Hansen Chiropractic and Injury and everettpainrelief.com. Thank you.